is wound management in a dog with multiple bite marks at the face and the neck region. On presentation, after the initial examination, we found 4 bite marks in the face, and then the affected side of the ear was inflamed, including a bulge at the cheek region. After sedation and anesthesia, we did further examination, and on wound assessment, there was bleeding at the bite marks, especially on one side. Then the size of the bite marks was small enough to avoid stitching. Then there was also evidence of dead space at the lower aspect of the jaw. And with the extensive bleeding, but the bleeding wasn't copious. Then on further palpation, we were able to squeeze out a bit of the bleeding through the bite marks. Then there was no infection in the wound. So from our assessment, all that the dog needed was flushing the injured tissues with some antiseptic, followed by application of infusion of hydrogen peroxide to try and kill off the tissue from the inside, and also to further clear off infection. So after infusion of hydrogen peroxide, we rinsed out with normal saline or sterile water. After lavaging with normal saline, we applied some more antiseptic, the dilute antiseptic, through the bite, through the opening that was patent. After that, we had 2 options. Option 1 was to put in a drain, so that there's constant drainage. But this one is usually indicated when there's infection in the wound, and this would have been shown by discharge of pus through the patent regions. But in our case, there was no pus, so we decided not to put in a drain. Then what we did was also cleansed off the surface with some antiseptics, and then application of some topical medication that is meant to accelerate wound healing. So there are several of those. In our case, we used GB paint. In some cases, you may need to use acrosal or healing oil, also known as ozonated oil, or use of a topical antiseptic cream, or for sure cream that contains both antibacterial and antifungal properties, and also meant to reduce inflammation. Systemically, we put the dog on Loxcam as an anti-inflammatory, and also for antibiotics we put the dog on as Septrin to try and prevent infection. After wound treatment, the dog was discharged. 3 to 4 days later, the dog was brought back with extensive Three to 3 days later, the dog was brought back. Apparently, it was self-mutilating and it was pawing at the wounds, causing the bite wounds to tear. So the openings were big enough to warrant stitching. Unfortunately, we couldn't put a buster collar because the dog was constantly prying it off the head. So this is the presentation of the dog after constant mutilation. As you can see, there are now 3 gaping wounds, and then there's also evidence of dead tissue on the caudal edge of the cheek, extending to the chin. So there are about 4 open wounds, which would be impossible to heal on their own by second detention. So we had to sedate the dog, debride off all the dead tissue from the surface, using a scalpel blade, and then further debridement using hydrogen peroxide. Then we clipped off the edges of the wounds with a scalpel blade. This is to create a fresh wound around the edges, remove dead tissue from there, and also help increase blood flow to the surface. That way, upon stitching the wounds, there will be enough blood flow in that region to help wound healing. So all the gaping holes were stitched off. Now for the bite wounds, which upon stitching would end up forming dog ears, we had to do a VY plasty by extending off an incision, a triangular incision, and removing a triangular piece from the edge, and then restitching to prevent dog ears from forming. Upon stitching, we gave anti-inflammatories and antibiotics for an extra 5 days. Then the dog went home for approximately 14 days, after which it came for stitch removal. On the day of stitch removal, all the swelling on the face had completely cleared. And upon removing the stitches, there was no evidence of swelling or even the tissue in the region. The patient had recovered normally, was eating normally, and there was no sign of the bite wounds except for the scars. Thank you very much for listening in. Please consider subscribing to this channel, as it will help us reach more people. Also, click the like button, as this helps with the YouTube algorithms in terms of the reach. Thank you very much.